Now they've told you that you had a cardiac arrest, or as what we other people know it as, a heart attack. Now you're worried. Maybe you need surgery, you get a whole open heart surgery done, etc. Not all the time. Not all the time that is needed. That's why we have something called angioplasty, or some people call it PCI or PTC. Now, what is angioplasty? Angioplasty is a coronary interventional procedure where we go into your heart without cutting you open. We either go through your radial access or your femoral access. Now, what happens afterwards is we use catheters, wires, balloon, and stents. Now, the stent is the most important part. Stents, for example, we have DES, known as drug-eluting stent. So this stent is like a mesh basket metal that releases drugs gradually, micro drugs, into your coronary arteries, which then breaks all the plaques and the fat buildup, even calcium buildup in your coronary arteries. So it breaks them down gradually over the years and is a lifetime thing. So the stent will remain in your heart for life. That is what coronary angioplasty is basically all about. Not more than this. So now you might be thinking that your doctor told you it's a 50-50 chance you need angioplasty or you need surgery. So that depends on how bad the coronary arteries are, and there'll be other things also to look towards concerning your health, maybe diabetes, whatever the case may be, or your past history. So these things will be looked upon to consider you fit for an angioplasty or fit for a bypass surgery. Yes, it can. Let's take an instance where a patient comes into the hospital complaining of severe chest pain, and the patient is feeling dizzy with a very, very elevated blood pressure. Afterwards, we get an angiogram done. Now, when the angiogram is done, we see that you have very terrible blockage in your coronary arteries, one that can take out the person in a few minutes. Now, that's where angioplasty comes in place. So what can angioplasty do in this right now? We'll have to put the stent in to quickly open up that clogged or blocked coronary artery, just to open it up, to restore blood flow back to the patient's heart. That's how it can save your life. Now you might be wondering who can have a coronary artery disease. So these are the list of people who are at high risk of having coronary artery disease. So we have people who are hypertensive or have the family history of hypertension, who are diabetic or have family history of diabetes, and smokers, anything that brings out smoke from your mouth, and smokers, all of it is involved. Alcohol abuse, substance abuse, and I mean all substance abuse. Then we have the age factor, because the older you get, if you realize that you have any of these things that have been mentioned, if you have any one of them, you should get your heart checked. The older you get, you need to get your heart checked, know your calcium level, know your normal blood pressure, and know etc. Just know everything concerning your heart the older you get, because you cannot age backward actually.